makapag-transmit pa siya ng iba. And the patient number 2 is hindi po siya pasok sa criteria, but still, all of these 2 cases are well coordinated sa mga RHUs or sa provincial like Cotabato. May monitoring team po doon.
I see. Dito naman, Doc, sa CRMC, sa may isolation room, kumusta yung pinapatupad na, kumbaga, sa mga tao may pasyente dito, sa mga papasok dito, sa mga, ano ba tawag yan, sa mga visitors, sa mga pasyente dito? Kasi iba parang natatakot kapag masabing may PUI dito sa CRMC.
Okay. So the hospital management, since na lumabas po itong the public emergency call ng ating presidente, the management make sure that the employees, even the patients, are safe in the vicinity of the hospital. So pinapatupad po natin yung protocol for the proper sanitation in and out of the hospital, screening of the visitors, no? Even sa ER and sa OPD, may mga protocol tayong sinusunod for hygiene, promotion, sanitation in order to prevent the spread of infection. We're not just talking about here the COVID kasi yan ang latest, but all of the diseases that can be transmitted by means of contact sa person. No? So yun yung muna namin kino-concern. And even the flock of the visitors, watchers, mamaya i-announce po sa inyo ano yung bago sa sistema ngayon ng CRMC management in terms of catering our patients and watchers at the same time.
Doc, good afternoon po. Sandra Sirilia from Brigada Cotabato po. Tanong ko lang po, gaano kahanda ang CDLGU at the same time ang mga health offices po regarding po dito sa COVID-19?
Yes, gaano kahanda. No? I could confidently say that we are ready, we are prepared, organized natin from barangay up to the referral hospitals like CRMC and NDH, and yung referral flow natin is established na. So, ito kasi siya sa matter of time, no? Kung kailan dating, that's the time that we could say na ma-assess kung handa pa talaga. Sa ngayon, we're doing everything we can. Lahat ng health workers natin, be it private or government, under red alert status, and heightened surveillance namin. Ginagawa natin ngayon is hindi na tayo naghihintay ng pasyente na lalapit sa health centers. Kami na mismo, nag-house to house, naghahanap ng mga priority. Number 1, yung mga balikbayan with history of travel dun sa mga COVID-affected countries. Yan ang instruction ko sa lahat ng ating health workers in all 37 barangays is active case finding. No? As early as possible, kailangan ma-identify natin kung sino yung may mga travel outside, may mga history of exposure doon sa mga confirmed case, lalo na doon sa Metro Manila. And immediately, we could classify them kung ano ba, may presence or absence of symptoms, and immediately we could classify them as a person under monitoring, patient under investigation, and then we could do the appropriate recommended intervention based on those classification. So oriented, lahat ng health workers ng City Health Office, around more than 200 plus of them, every now and then, ina-update natin sila, the latest decision tools, guidelines from the Department of Health and the DILG. Just like this morning, we had another meeting to reiterate yung kailangan yung heightened surveillance and early detection. Kasi mas earlier na ma-detect natin, mas limited yung mga tao may expose dun sa mga PUMs and PUIs.
Marami, Ella Dayawan of DXMS, Radyo Bida. Sir, marami kasing lumalabas sa Facebook na akala natin yun na. May mga gamot na lumalabas, yung pagkain ng bawang, 1 bottle, yung ganun, mag-inom ng tapos ang sex din daw, pag regular nagsisex, ay makaprevent ng COVID. Paano natin i-advise yung ating mga Cotabateños? Ano ba talagang dapat gawin? Ano yung mga ganyan mga balita na lumalabas po?
Okay. We strongly advise our constituents, ating mga kababayan, to read or share articles doon lang from reputable sources like the Department of Health and the World Health Organization, to avoid yung mga misinformation, disinformation, sharing of fake news, which could lead to panic and anxiety sa public. So unless it is verified, validated, and Department of Health mismo ang nag-pronounce, huwag po munang basta-basta paniwalaan yung mga kumakalat na mga post sa Facebook. Unless si Secretary Duque na mismo ay nagsabi na ang sex ay makakatulong sa COVID o kaya yung pagkain ng malunggay o ano pa man dyan. Unless hindi siya gumawa ng pronouncement, hindi muna dapat paliwalaan ng ating mga kababayan.
Di ba dapat may isolation area per barangay daw? Sa Cotabato City, na-comply ba ng mga barangay yun?
Yes. Under DILG Memorandum Circular 2020-023, required every barangay to have their own BHER. Number 1, BHER, Barangay Health Emergency Response Team, at least one team for every 5,000 population. Number 2, kailangan din sila ng magkaroon ng isang barangay isolation unit. And pangatlo, magkaroon sila ng barangay health information center or yung hotline o call center. Yung question is, meron na ba lahat ng barangays? Be heard, lahat ng barangays nakapa-organize na. Organized and activated na. In fact, gumagalaw na ngayon. Be heard, lahat ng 37 barangays. Pagdating sa barangay isolation unit, yan yung medyo nahihirapan yung mga barangay officials natin. Kasi ang barangay isolation unit is a temporary facility, either old house or abandoned building na dapat medyo malayo sa general populated areas, but should remain accessible sa mga health workers and members ng BHER. Kasi every day, doon bibisitahin nila yung mga naka-admit doon na mga patients, persons under monitoring. So sa ngayon, around 2 to 3 barangays pa lang ang nakapag-identify ng mga barangay isolation unit. Binigyan natin sila until Friday. No? We keep on reminding them, pinipressure natin sila kasi kailangan ito. Because we do not want the hospitals, limited lang capacity natin ng hospitals, bed capacity sa Cotabato City. We do not want the hospitals na ma-overwhelm ng patients. Kahit na mild lang, hindi naman kailangan i-admit, ay pupunta ng hospital. So instead, yung mga naka-home quarantine na hindi pwedeng ma-quarantine sa bahay kasi congested, maraming tao, mga anak, kamag-anak, or walang available room doon sa bahay nila, pwedeng dalhin doon sa barangay isolation unit. So ngayon, every now and then, remind natin, sinicheck natin ang mga barangay officials na makapag-identify na ng kanilang mga barangay isolation units.
Samsali nga pala ng Alex. Isa pa, sabi ng World Health Organization, mas delikado naman pala ang TB kaysa sa etong coronavirus na ngayon. Bakit masyadong nabigyan ng sobrang exposure ng coronavirus na nagresulta sa sobrang takot ng marami? May TB naman pala na mas nakakatakot para.
No? Infectious disease special.
Okay, so the TB kasi, alam na natin paano natin nakukuha, sino-sino yung pwedeng magkasakit, at ano yung mga sintomas. Well, define na sa atin ng government and the medical professionals. So with this COVID-19, since it is novel, bago, we have a limited background of the problem. So, kaya natin tinututukan kasi hindi pa natin alam definitely anong behavior niya. Okay? So, yun yung isang point ng government natin to focus on how can we prevent the spread of this one. Kasi we know already how to prevent the TB infection to spread, established na siya. But this one, since it is novel, bago, limited pa yung alam natin. At ngayon lang, so maraming na-surprise, no? So yun po yung reason. Pero it doesn't mean na dahil bago siya, ngayon lang natin na-discover, siya na lang i-focus natin. No. All of the programs of the government, mapa-TB, mapa-dengue, malaria, still on hand pa rin yan. Focus pa rin, meron pa rin tayong teams, program manager to look onto these mga program management with the different diseases na existing ngayon. No? And this platform that we shared to you, is very much grateful sa amin kasi pinaglakan niyo kami. And this is also our avenue to inform the public ano ba ang difference ng PUI at the COVID-19 infection. The PUI, hindi po ibig sabihin na person under investigation ka na COVID-19 infected ka na kaagad-agad. So kaya po natin ina-admit, ina-isolate, and wino-work up sila for us to identify them kung talagang meron silang dala-dala. And once they are laboratory confirmed, ibig sabihin from the RITM diagnostic workups for the COVID-19 infection at confirm po sila na po yung tinatawag nating COVID-19 infected individuals. So PUI, ibig sabihin under investigation. So we have no definite say na COVID-19 infection. Kasi po nami-misinterpret ang public na ang pag-PUI ka ay COVID-19 na. So, yun na rin yung nagiging reason na parang chaos na sa lahat. No? So, yun po yung gusto namin paintindi. Once PUI ka, hindi po ibig sabihin COVID-19 infected ka na. So, you're just subjected to be worked up and determine if you meron ka dala-dalang virus sa katawan. And how about the PUM, person under monitoring? These are individuals have no symptoms, asymptomatic po sila, but they have a exposure to a certain COVID-19 infected individual. Yun po yun. No? And paano naman natin nililabel yung PUI, person under investigation? Once they have a symptoms like fever, cough and colds, and other respiratory symptoms, plus ngayon po dinagdag po ng aming society, that Philippine Society of Infectious Diseases and Microbiology, and ang ating Department of Health na isama yung diarrhea sa criteria. So fever or cough and colds or diarrhea plus history of travel or close contact to a person confirmed with COVID-19 infection. That's the time nililabel natin sila person under investigation, and then it will be verified, validated by our surveillance team from the Department of Health. No? Kung galing po ng city, reso po yung tumitingin. Outside the city, MESO, PESO. Ibig sabihin, provincial surveillance team and municipal surveillance team. May kanya-kanya po silang trabaho. And once they call it na PUI, kung saan po na pinakamalapit na hospital na level 2 and level 3 who are equipped to manage the case and identify the patient, that's the time, din po natin sila nire-refer at kino-coordinate po. So, here in the city, who are the level 2? Notre Dame Hospital, who are the level 3? Cotabato Regional Medical Center.
May available pumunta ba tayo ba?
Okay, in terms of medication, as of this time, wala po tayong antiviral particular to COVID-19 infection. So, what we're doing is we manage accordingly. For example, nakitaan namin ng pneumonia, we manage the pneumonia. Kung severe type ng infection, we manage the severe type of infection. So, case-to-case basis po. Depende po sa ano po yung assessment ng current status ng patient.
How true yung sabi, parang experimental daw ito. Parang gawa lang din ng mga gumagawa ng gamot. Nagpakalat ng coronavirus and then at the end of the day, magbebenta ng kanilang magbebenta ng kanilang cure, medicine, and then parang ang pinaka-bottom line is negosyo. I don't know kung
actually, yan ay mahirap sagutin because we don't have any concrete answer for that. Siyempre, ang tao kasi, malawak kasi mag-isip ang tao. So, isa-isa ito sa mga pwede nila ma-point, bakit lumabas to. Okay. So, for us, as in the medical side, we cannot say something about it kasi wala pa tayong concrete details about it.
ang dami-daming experts sa social media, ang dami-daming nagpapakonsulta sa social media. Ano po ang advice niyo sa public? lalong-lalo na sa yung mga tumututok sa social media. Kasi ang daming tawag dito, madaling maniwala ngayon sa social media.
Feeling expert.
Oo.
So as what I have said kanina po na we do advise the public to refrain from spreading unverified information, and they can consult the website of our government, particularly Department of Health, and so mga announcement from the National Department of Health, doon po sana sila makinig. So they can be guided. So, and we are promoting proper hygiene etiquette for each and every one of us, because it will not just prevent the COVID, but the other circulating diseases na meron tayo existingly ngayon. So yung mga nasa social media, yun yung choice nila eh. Pero for us as in the medical side, we do advise for the authorized announcement of any medical concerns. We can refer and check the website of the Department of Health, and yung mga announcement po nila na that is publicly shared naman po. And even the other seniors that I'm known with, you know, nag-reach out na rin po sila to educate the public. You know? So sometimes kasi mas madaling ma-access yung nasa net, no? Sa social media. So yun nga. Kaya ako na, ito yung isang meme namin na to correct the notions of yung mga napupost sa media. Kasi bombarded tayo ng mga fake news. So we want to set things straight, and we want to give a concrete official statement para wala na pong magkaroon na mabiktima ng fake news.
Opo. Last na lang po mula sa akin, Doc. Sa prevention, garantisado ba yung simple na paghuhugas ng alcohol sa kamay at pagtatakip ng mask sa mukha?
Ang viruses kasi, we have our means to protect ourselves. So, these studies, yan ay proven, no? Kaya ko namin ni-reiterate sa inyo kasi studies so ang ating pinagbabasihan. And from the protocols and which are been proven, studied na yan siya even before. So, for us to prevent transmission, hand hygiene, by means of using soap and water, kung walang available is 70% solution ng alcohol. No? May, yan na po, proven and tested na kasi siya. So, we're, teaching the public again na ano yung mga na-prove na natin na makaka-prevent for the transmission is the one we're sharing to you.